It's a Northwest News Radio weekend. IRG's Health Talk continues.
Welcome back. First guest, Dr. Rachel Winstedt, a naturopathic physician. She has her own practice talking about the discovery call and health consultations and naturopathic visits and osteoporosis in particular, some of the symptoms that you might find in that. And Shannon, osteoporosis usually has to do with the bones and bones kind of deteriorating or weakening.
Yeah, osteoporosis is a weakening of the bone, a lack of calcium deposit or bone deposit. And a lot of times we see this in aging, mostly in probably the female population more than the male population is where you hear about it. But osteoporosis can be, a problem because the bone does become weak and you can fracture your bones. And, the bones, your skeletal system, it's interesting, is always constantly rebuilding and depositing, new bone growth. And osteoporosis, when that bone becomes brittle, lack of kind of rebuilding, and that's what an osteoporotic bone looks like, and it's susceptible to fractures.
All right, Dr. Rachel Winstedt and Shannon O'Kelly.
Dr. Winstedt, welcome to Health Talk. How are you?
I'm well, thank you. I'm excited to be here.
We're excited to have you. You're a naturopathic physician. I always like to try to figure out how your interest and your passion and how you became a naturopathic physician. Where did it all start?
I want to say it started in childhood. I always knew I wanted to be a doctor. And growing up, my parents always took us to integrative, what we call functional medicine doctors. So I always thought that doctors talked about diet and lifestyle and being active and making sure you got enough sleep. It wasn't until I was in college that I realized MDs do not do that. So after that, I ended up headhunting doctors for my first real job out of college. And then I met a naturopath. I realized they practice medicine the way I wanted to practice medicine. Treat the cause, nourish someone, help them live their best life free from pain, free from stress and disease. So I ended up falling in love with naturopathic medicine, and I've never looked back.
For our listeners out there, what would you say the difference is between what you do and maybe some of your colleagues or contemporaries?
Great. There's no bad form of medicine, but there's a form that I tend to gravitate to, which is no bad therapies, just not the right therapy for a person. And in order to know what therapies might work for someone, you have to have a really big knowledge base of the way the body works, the biochemistry, the physiology, and taking all this amazing education I got at Bastyr University, where my doctorate's from, I can then use all the tools. Sometimes I use a pharmaceutical. Often I try to go for diet and lifestyle changes to support someone who has an illness like prediabetes or stress, anxiety, depression, and treat them from a way that helps directly affect and reverse the disease, the illness, rather than just prescribe a one pill for one symptom approach. And that's kind of what a naturopathic doctor does. They look at the whole person. They spend a lot of time talking about their background, their past medical history, their education, and then knowing all the biochemistry and the genetics and how the natural world has all these fantastic plants and minerals, and taking those things and using them and how they interact with our own unique biochemistry and affect disease. We are able to kind of thread the needle between not using too many pharmaceuticals, using more holistic, supportive agents that help a person get back to their healthy, vital, free self.
You know what I love about this conversation we're having right now is I've been doing this physical therapy thing, and I love it. I'm actually passionate about it, and I feel very fortunate. I don't really feel like I've ever worked a day in my life because I've enjoyed my profession so much. But over the last 35 years of doing this, I see more collaboration and I see more bridging of naturopathic and traditional medicine, holistic medicine, which ultimately I think is great for the patient. Matter of fact, just the other day, I was listening to, I don't know if it was a podcast, but mentioned that for every 10% of your diet that is in high processed foods, which Americans eat a lot of high processed foods, for every 10% you increase that, I mean, your increase for some kind of a cancer or disease is increased. So diet and just the way we eat is so important. I think people are starting to realize that. Would you agree?
Oh, I agree 100%. In this country, we are overfed and undernourished. Let's just talk about agriculture. The way we produce food, we have to make lots of food because we've got a lot of people to feed. And let's not even get into the fact that food is expensive. And there's also food deserts, which make it hard to get fresh fruits and vegetables, let alone have the time to prep them and make them for our families and for ourselves. Just white bread, for example, when we process it, it loses like 85% of the magnesium. It loses 60% of the calcium, not to even mention other phytonutrients and B vitamins, all things that our bodies rely on to function well.
Yep. Dr. Rachel Winstedt is with us today talking about naturopathic medicine, and we're going to come back in just a moment after a break, and we're going to get into some areas of her practice where she is an expert and practices things like osteoporosis, for example. So we'll chat in just a moment.
More with Dr. Winstedt and Shannon O'Kelly next on Northwest News Radio.
It's a Northwest News Radio weekend. Here's Tom Hutler and Shannon O'Kelly. This is IRG's Health Talk.
Our conversation regarding osteoporosis continues now with Shannon O'Kelly and Dr. Rachel Winstedt.
Dr. Winstedt, thank you again for joining on us Health Talk, naturopathic physician. What is your why? Why do you do what you do? And what is your inspiration and motivation? How about for you?
What it comes down to is I feel my best when I'm in service to others. I think this is something I observed in my grandmother, bless her. She's lived to be over 100 years old, mostly healthy. But it's something about being of service to others makes me happy. So it's kind of, I help patients, but I have the best job in the world. I get to talk with them. I get to listen to them. Patients are smart. People are smart. They tell you what they need. And then I get to nerd out and tell them about the things I enjoy researching. It's just so phenomenal. I just can't even tell you how great that makes me feel. It brings me so much joy just to help people thrive.
That's exactly what going to be in healthcare. We should all have the passion that you have. Tell us about, from your standpoint, maybe as 2 minutes here left in this conversation, it's a big topic, osteoporosis. How can you help in osteoporosis, and what is your intervention there?
Big topic. I think osteoporosis prevention should be starting in your 30s. We, as women, hit our bone density peak at 22.
Wow.
After that, it's like build and breakdown of bones just kind of is at a standstill until we hit menopause. When women, estrogen helps keep our bones dense. Women have a drop in estrogen at menopause, and we should be doing things to keep our estrogen, if appropriate for other medical needs, high or at an appropriate range to keep our bones dense. We can also talk about nutrition. A lot of whole foods diets, healthy phytonutrients, meaning the nutrients that we get from vegetables, antioxidants, making sure we get enough calcium in our food, not to even neglect things like hormones. We need to have enough sleep. Our bones have like over 200 different proteins in them. Yeah. And things like melatonin, our sleep hormone, or so we thought, actually help us make stronger, healthier bones. And then I see a lot of patients who are on a lot of prescriptions, at least when we first start. And these are prescriptions they need. Mood stuff. It's for acid reflux, for autoimmune conditions. These are prescriptions that often have a natural alternative that does not cause us to lose our bone density, which is the thing that happens before we have osteoporosis. I have a great job. I get to tell patients, hey, let's also talk about your lifestyle. Are you going for a walk? Are you getting 7,000 steps in a day? How is your stress? We know that chronic stress releases cortisol, our stress hormone, which is something we need in short bursts. Well, that chronic stress creates inflammation. Inflammation causes us to have bone density loss. I just want to make sure that patients understand that their bodies, there's no system in their bodies. It's all connected. And the things we put in our mouth, the things we don't put in our mouth, stress, the way we handle our stress, the sleep we get, the prescriptions that we use to help treat a symptom, they all affect our bone density. And I don't want to see my friends, my family members end up in the hospital. Every year, over 300,000 Americans will fracture a hip, and 36% of those folks will die within a year. I don't want to bury my friends.
It's staggering.
I want to have a strong, healthy community.
Absolutely. Thank you for sharing that passion with us and that information. We'll have to have you come back on Health Talk in the future so we can continue to have this conversation, because I can tell you love what you do. But right now, I just want to thank you for joining us.
My pleasure. I love people. I love what I do. And any day I can help someone live their best life is a great day.
Thank you.
You've been listening to Dr. Rachel Winstedt talking about osteoporosis, along with Shannon O'Kelly. She's a naturopathic physician, and you can get more information at her website, rachelwinstedt.com. Shannon, osteoporosis, that was something my mom had. You mentioned more common in females.
Yeah, it is more common in females. A lot of it has to do with as they go through menopause and different changes in hormones. You know, again, the bone is not redepositing and building, and it becomes brittle with holes in osteoporotic. And yeah, very common in women particularly.
We're back with our next guest after this time out on Northwest News Radio.